This video should help you understand what it means to be psychotic. What exactly is psychosis? Psychosis is a change of perception in reality. It has abnormalities in one or more of the following domains: delusions, hallucinations, disorganized thinking, disorganized or abnormal motor behavior, and negative symptoms. Delusions are one of the abnormalities that can be found in psychosis. Delusions are fixed beliefs that are not likely to change in light of conflicting evidence. Delusional content may center around a variety of themes. There are persecutory delusions, which are the most common type of delusion. It's the belief that someone is monitoring or trying to harm the patient. In referential delusions, there are subtle things occurring in an individual's environment that are cues which hold significant meaning. Somatic delusions are irrational beliefs about a person's body. These can lead to unnecessary medical consultations, tests, and even operations. Religious delusions are another common type of delusion. It can be believing that one is God or an angel or anything along those lines. It's important to determine if the belief is culturally appropriate, such as if a person is of the Christian faith and they say that they are talking to God, they're not necessarily delusional, they just may mean that they're praying. Grandiose delusions are grandiose beliefs about oneself, about one's abilities, about fame, about wealth. An example would be a patient believing that they're going to be the next president because they are brilliant in the political sense. Some other types of delusions are erotomanic, which is the belief a person or a famous person is in love with them. Nihilistic is the belief that a major catastrophe will occur. There are delusions of control, about the will, thoughts, or feelings being under control by external forces, and there are delusions of mind reading. Another aspect of psychosis is hallucinations. These are perception-like experiences that occur without an external stimulus. They're vivid and clear, and they have the full force and impact of normal perceptions. They are involuntary. A patient with auditory hallucinations can hear one or more voices talking to the patient or talking to each other. There are also command hallucinations in which the voices tell the patient to do something, like to kill themselves or to go hurt someone else. Visual hallucinations are simply seeing things that are not there. Tactile, olfactory, and gustatory hallucinations have to do with things that you feel, that you smell, or that you taste. These types of hallucinations are not common with psychiatric disorders. They're common when a patient has an underlying medical or neurological problem. Another aspect of psychosis is disorganized thinking. This is assessed by speech patterns. And then there are several forms of thought disorders. A couple of them are cling associations and tangentiality. In cling associations, it has to do with the way that words sound versus their content. And tangentiality is a way that people express themselves when they're not staying on topic necessarily. Their response can be relevant to what was asked or what was said prior in the conversation, but it's not a direct response. An example of tangentiality would be If I asked someone, "Where did you go this afternoon?" and they responded, "Sometimes when it's the afternoon, I like to go places." That was somewhat relevant, but it didn't answer my question. Psychosis can also be disorganized or abnormal motor behavior, which is the inability to complete goal-directed activities. Catatonia is one aspect of this. During catatonia, a patient is rigid, with an inappropriate or bizarre posture. Then the last aspect of psychosis is negative symptoms. These are commonly seen in schizophrenia. One type of negative symptom would be diminished emotional expression. Another type would be amotivation or lack of motivation. Another would be poverty of speech. There is also inability to experience pleasure, and there's asociality, so just not wanting to be around people or to socialize. Thanks for listening, and look out for more content from the Modern Psychiatrist.